Hi everybody and welcome to the 3-minute series of the Italian study group on craniomandibular disorders. Today we are going to talk about TMJ imaging and this condyle relationship. At closed mouth on the left side of your screen, normally the disc position is considered physiological when the posterior band of the temporomandibular joint disc is positioned at 12 o'clock with respect to the mandibular condyle, whilst in the open mouth position, the physiological relationship provides that the intermediate band is positioned at 12 o'clock with respect to the condyle and the articular tubercle. Look at the butterfly and typical biconcave disc shape. When in the closed mouth the disc is positioned anteriorly with respect to the 12 o'clock position and it is recaptured during condylar translation, we have a diagnosis of temporomandibular joint disc displacement with reduction. Sometimes it happens that the temporomandibular joint disc is positioned too anteriorly with respect to the condyle to be recaptured with condylar translation. In these cases, the diagnosis is disc displacement without reduction. Please note that the condylar head is affected by erosion and that despite the obstacle of the disc, the translation of the mandibular condyle is almost physiological, and that's a rule. It is not necessarily limited by the obstacle of the temporomandibular joint disc. When the displacement is chronic, it happens that the anteriorly positioned disc is severely deformed and there is a concurrent severe erosion of the condylar head. The disc may assume a typical hook-shaped position and it is moved forward by condylar translation, which remains physiological in spite of the obstacle represented by the temporomandibular joint disc. In these cases, the diagnosis is disc displacement without reduction and without a limited opening. If you want to know more, please visit the website and the Facebook forum of the Italian study group on craniomandibular disorders. See you soon!